This is the first of three talks that I'm planning to do regarding emotionally unstable personality disorder or borderline personality disorder. I'm doing it for people who've been recently diagnosed or for family members of people who have been recently diagnosed. The hope is that I will share this knowledge with people with this diagnosis. This is not a medical treatise. It is not expected to teach you and train you and give you some new knowledge, but this is about what EUPD is, how you can share this with the close family members that you have in case you suffer from one, or in case if you know that somebody who suffers from, to understand what it is, and of course share some knowledge about what treatment options are available. It is one of the most common type of personality disorder. People experience intense and fluctuating emotions which can last anywhere between few hours to few days. These quite severe emotional reactions swinging from being very depressed to being very high can cause significant problems in day-to-day life. For no reason at all, people can start feeling very depressed, they can feel low, they have no motivation, no energy, they don't want to talk to anybody, and more worryingly start getting thoughts of self-harm. On the other spectrum, they can start feeling very happy, start doing risky stuff, have a lot of self-belief and confidence, start engaging, start talking to people, and they are the life of a party. The problem remains that this swing is not under their control, and this impacts day-to-day life significantly. The self-harm, intrusive thoughts that they struggle with can have a big impact. For people who have this diagnosis, would have ended up engaging with some kind of mental health services in emergency, and the biggest tragedy is that the amount of respect this diagnosis is given is pretty low. Not many staff working in mental health in A&Es believe, or they believe that these difficulties are a choice, which cannot be further away from truth because it's a diagnosis. By definition, if you become ill, you have no control over it. Usual contact with emergency mental health services is because of self-harm, ideation or actions or suicidal thoughts. Now, for people who are listening to this who do not have this diagnosis, I would like you to consider how many times in the last 5 years, 10 years, have you had intrusive, ongoing thoughts of doing something to harm yourself or not wanting to be here. It is extremely important to appreciate that people with EUPD do not look any different. However, they have limited control over their intrusive thoughts. It's not a choice they are making. Hence, not respecting this is perhaps not fair. About 1.6% population suffers with this diagnosis, mostly females, but in the last 10 years of my practice, I have seen a lot more males suffering with this as well. Very recently, some people might be aware of this, there is another subtype that's been diagnosed, or not a subtype exactly, but a different diagnosis, that of complex post-traumatic stress disorder. And there are subtle differences between EUPD or borderline PD and complex PTSD. However, the challenge is that a lot of emergency service personnel do not know the difference, believe it to be the same, and do not give the same kind of respect, a patient ear, a hearing to somebody who's been struggling enough that they have sat in the A&E for hours to share their life story with a complete stranger. This is not what people do if they don't need to. Along with emotional or affective instability, people with this diagnosis also suffer with anxiety, depression, impulsive behaviors, under which come self harm, or it could be related to inappropriate behaviors, taking alcohol, drugs, spending too much. But this is a destructive behavior in itself. One of the important symptoms of this diagnosis is episodes of dissociation. Because of somebody's arousal level, which is always so high, extreme stress, their minds cannot manage and they dissociate from reality. So at that time, they can end up hearing voices or becoming paranoid, and once they're out of that episode, may not remember what happened. So, as I mentioned, mood instability, intrusive thoughts of self harm, uh, periods or episodes of dissociation when under stress, impulsive behaviors. These episodes of dissociation can be very scary for anybody who goes through that, because your brain doesn't take in what is happening to you, and you suddenly start becoming paranoid, not connecting to what's happening. Of course, once this episode is settled and somebody hears what's happening, there is associated guilt and shame, adding to the burden of feeling depressed and anxious. A lot of my life, when I deal with this client group, is about sharing with everybody around them that it's not really a choice. No illness exists due to choice. And sometimes it is difficult to appreciate for family members, for support staff. I, in my second video, will talk a lot about how it presents itself, what are the detailed symptoms, and in the third video, how to talk about from treatment modalities that has evidence of it working. Very shortly, there are treatments for EUPD, but they are not compatible with the current criteria of an episode with intervention sorting out. EUPD is a quite long-lasting diagnosis. Hence, the treatment needs to go on for quite some time, on average about 2 years. And there can be challenges in accessing that treatment. However, there are things that people who have EUPD can do themselves. The ongoing pattern, the fear of being abandoned, and a chronic feeling of emptiness is something they feel all the time. This can have an impact on day-to-day living. It's important to remind ourselves every day that when people say things, do things, does not automatically equate to actions of abandoning people. It is possible all these mental health difficulties will affect self-esteem, confidence, self-image. And it's important to remind yourself that this is an illness, not you. It is important for people who suffer with EUPD not to let this affect ongoing burden that you're carrying to affect your self-esteem, not to start self-hatred. People with EUPD can also struggle with self-image, body image problems. This is about feeling secure in who they are and what they are doing. Hence, it is an everyday endeavor to remind yourself that this is an illness. This is not who you are. There will come a time when the severity of symptoms will reduce, things will get better. But I appreciate that when your mood is swinging from one end to another, and it has been going for so long, it is very difficult to keep it together. I'm hoping to talk about treatment options in third video, but I think it's important for you to know that there is help available. Hospital admissions play a big role in managing this client, in a sense that hospital admission is a safe place and people with this diagnosis want one, and there's a lot of research out there to say that giving somebody that artificial safe space prolongs their journey of recovery. It has a big impact because relationships are a challenge for people with this diagnosis. They move from liking somebody to hating somebody, the black and white thinking having a big impact on their relationships. With so much difficulties, a lot of these people will indulge in alcohol and drugs, or develop eating disorders, or engage in self-harm. I repeat myself when I say this, in case people who are listening to this video are people who know somebody with this or support somebody with this. Almost all the symptoms of EUPD are not a choice. They are part of an illness. It's not something that people who have can control. Nobody would go through that kind of pain and carry so much burden by choice. So if I was to make a list of symptoms, I would say impulsivity that can lead to alcohol, drugs, inappropriate connections, relationships, self-harm. Mood swings from one end to another, lasting for half a day to a few days. An overwhelming fear of abandonment. Chronic feelings of emptiness. Episodes of dissociation that can include paranoia, being suspicious, episodes of extreme anxiety or depression, suicidal or self-harm behaviors because they are carrying so much burden. These are intrusive thoughts that impede on their consciousness. Having black and white thinking, which leads to unstable relationships. People move from liking somebody to completely hating them over just a period of minutes to days. This is a function of the fear of abandonment. This is a function of mood swings. This is a function of not being able to contain and manage what is giving you grief. I hope you have found this video helpful. This was about increasing the knowledge of what EUPD is. In my next video, I will talk a little bit more about how it presents with a few examples. And in the final video, I hope to talk about some treatment options that you should already know in case you have a diagnosis, but if not, please do the research, and for family members and close loved ones to understand what helps and what you can do. I wish you all the best. Have a very good day.